Hello, my name is Danielle Nita. I am specializing in physical therapy, and today we are going to do stretching for someone with cerebral palsy, and this will be my assistant, Joey. Alright, our first stretch today is going to be the quad stretch. There's two different positions for doing the quad stretch. You can either do it standing or you can do it laying. Standing is going to be for someone that has a better sense of balance, and laying is going to be someone with poor balance or poor strength. For standing, you can either use the wall or the chair to help with the balancing, but today, for our purposes, we're just going to use the chair. So we're going to put both hands on the chair while I help get the strap on. The yoga strap is going to help with him stretching as much as he can. So I'm going to put it on around his foot, and then I'm going to give the strap over his shoulder to him. Then I'm going to ask him to stretch as much as he's comfortable with. And then I'm going to help put a little bit of pressure on to help him stretch just a little bit more. Our second position today for the quad stretch is laying down. That is for someone with poor balance or someone that is not very strong. So, using the yoga strap once again, I'm going to put it around his foot. And then I'm going to ask him to bring his leg to a 90-degree angle to where, and then ask him to reach as far back for the strap as he can. And to pull to where he feels tension right along on his quads. And then once he feels tension, I'm going to go ahead and come back, and I'm going to put just a little bit of tension on there to help deepen that stretch. Our second stretch today is going to be external hip rotation. This is going to allow for more range of motion in the hips. So we can do it actively or passively. And so the patient is going to do the active stretch first. So he is going to turn his leg out, his hip, as much as he can, and hold it for 30 seconds. Or we can do it passively, which is where I will put my hand on his upper thigh and on his calf, and I'm going to rotate his leg out for him, and we're going to hold it for 30 seconds, and we'll do it on each leg. Our third stretch today is going to be knee and hip flexors and extensors. You can do it actively or passively. So actively, the patient is going to do it himself. So we're going to keep the knee on the floor and foot flexed, and we're going to bend it and bring it as high as he can to his side. And then he's going to extend from his knee out as far as he can, keeping a flexed foot. And he's going to do that and hold it for 30 seconds and get as deep of a stretch as he feels comfortable with. To do it passively, I will help the patient do that by grabbing at his foot, keeping his foot flexed, and grabbing behind his knee to help him bend his knee. And we're going to bring his hip up, his knee up, and then stretch out his leg as far as you feel comfortable. You're going to hold it for 30 seconds. Our next stretch is going to be the side hamstring stretch. So he's going to bend his left leg into the middle, and he's going to straighten out his right leg and bring it out to the side just a little bit to where it's comfortable for him. We're going to use the yoga strap again to help with the stretch. We're going to make sure his foot stays flexed. We're going to hand the strap to him, and he's going to hold it in a deep stretch that's comfortable for him, and hold it for 30 seconds each leg. Next, using the yoga strap, we're going to do the knee to chest stretch. So I'm going to put the strap on his foot, he's going to flex it, and he's going to bend his knee and bring it up into his chest, and I'm going to give him the strap, and he's going to grab it, and he's going to pull into his chest, and I'm going to add just a little bit of pressure to help deepen that stretch, and he should be feeling the stretch right in his glutes. And we're going to hold it for 30 seconds on each leg.